Well, according to a new survey conducted by the Canadian Liver Foundation, 56% of Canadians do not know that non-alcoholic fatty liver disease could lead to liver cancer, the need for a liver transplant, and even death. Joining us today to help spread awareness about NAFLD or NAFLD is Dr. Hemant Shah from the Toronto General Hospital and Melanie Braga. Welcome to What She Said.
Thank you for having us.
Thank you.
Okay, so NAFLD, non-alcoholic fatty liver disease, affects more than 7 million Canadians, adults to children. So it happens when too much fat is stored in the liver of someone who drinks little to no alcohol. Now, Melanie, you're from Toronto.
Yes.
And you were recently diagnosed with the disease 5 years after your husband was diagnosed with the same disease. Did you ever think that this would happen to you or to you both?
No, and part of the diagnosis was shock. Like, how could I have let that happen to me? Because I was so aware of how my husband got diagnosed. So it was shocking to everyone that it occurred to me too.
How did he get diagnosed?
Well, he already has another liver disease called Wilson's disease, which is a hereditary disease. Mm-hmm. So it was part of his annual checkup, and it came up in his blood work.
Well, I'm already in shock about 7 million Canadians. I mean, it could be more. I mean, I could have it. You could have it. I mean, how?
If there's no symptoms.
It's 1 out of 5 people. That's crazy. How would we know? Is there a test?
So it is the most common liver disease in the world, in all likelihood. In Canada, we think 20 to 25% of people have fatty liver. But in some jurisdictions in the United States, that might be 40 or 50%. There are no symptoms, and there is no specific test, which is often why it's difficult to diagnose. But the most common way that I think people are being diagnosed is if they have an abdominal ultrasound that includes their liver, often for some other reason, a bit of pain, discomfort. And then on the ultrasound, it's discovered that there's fat in the liver, and that makes the diagnosis.
Well, do you think, given the high incidence, that should be part of a physical?
You make an excellent point that there needs to be more awareness about it. I think I would make the point that the fat in the liver is no different than the fat that people accumulate in other parts of their body. Typically, for most of us, myself included, it's the abdominal fat that we get as we get older. So I think the way to think about fatty liver out there is that it's part and parcel of, the lifestyle choices that we make and the metabolic risk factors we accumulate as a result.
Okay, so but when most people think of liver disease, you think of alcohol as the only factor. Yeah. But instead of food or maybe inactivity. So who is at risk? We
are all at risk, and especially individuals who are overweight, who have an elevated body mass index. They would be the group that's at highest risk. For example, if diabetics would probably have a risk of about 80% of having fatty liver. So it goes along with a lot of the other lifestyle metabolic diseases that are out there.
So does it have something to do with diet and exercise? Not just BMI?
Yes. So the belief, and we're not really sure what causes fatty liver on such a broad scale, but it likely has to do with what we eat, and probably most to do with processed sugar and carbohydrate intake.
Sugar really is bad.
I think so. And I think that's why we've seen on the most recent Canada Food Guide update that there's been a move away from a lot of carbohydrate consumption. But it's processed sugars that came into our diet in the 1970s and 1980s that have led to this disease, which really didn't even exist in the 1950s and 1960s.
It's all part of that low fat. Everything was light and low fat, but there was so much added sugar to make it look good. Is that right?
To make it taste good.
Exactly. Taste good. That's right. Look good, taste good, yeah.
Well, for example, looking at now big fad, the Keto Diet, right, which is high fat but no carbs or sugar. So would that help, or would that be equally bad for this?
It's a good question. I don't think we really know the answer for me to tell you definitively one way or the other. From the perspective of diets that have been widely studied, probably the best studied diet that I recommend to my patients regularly is a Mediterranean-style diet.
That's what my doctor is
it's a lower carbohydrate diet, higher protein, higher fat diet. And if you look at studies of fatty liver, for example, individuals who are able to adhere or have a Mediterranean diet after the diagnosis and lose a bit of weight as a result of that, actually the fatty liver goes away.
So, Melanie, how did your life change after the diagnosis?
A whole lifestyle change. So I made sure what I was eating was healthier. As a busy working parent, I got into the hustle and bustle of just grabbing something quick to eat. And sometimes it's just me by myself because my husband works different shifts. So that extra pressure and then working. I have a blog that I write. So busy. So my comfort food was the fat food and the fried food, and a lot of pop. I used to drink lots of pop thinking that that's what I needed for that energy to keep with my lifestyle. But at the end, all that kind of destroyed me inside. So that was the consequence of getting that quick, French fry or that pop, thinking that I needed that to help my family. I needed that energy to keep going, but really it wasn't.
So now you've done a complete...
Yes, I'm very careful with what I eat. Going out is the hardest. I want that French fry, but I'll order a salad instead, and I feel bad that everyone else is enjoying that French fry except me. But I'm doing it for me, for a better life and to live longer, because that's what I want to live longer. And I exercise more.
Do you feel better?
Yes, much better. A lot more energy. I can keep up with my 4-year-old, and she has tons of energy. I'm not as tired. It's just a huge change.
How has your liver changed?
I'm 85% in the clear.
That's amazing. In 6 months?
In 6 months.
So it is reversible completely?
Yes.
Completely? Like totally?
There are different stages of severity of fatty liver. So some people have fat in their liver that doesn't actually injure the liver. And then there are people who have a more severe condition, which we call NASH, and non-alcoholic steatohepatitis, if you want to get really nerdy. But that condition can cause progressive liver injury. And that's when people end up seeing doctors like me, who are liver specialists, to grade the severity of that injury and think about actual therapies for it.
Well, the liver is an incredible organ. I lost a third of my liver in a stabbing attack, and it basically regrew. So, it's incredible what this organ can do.
Oh, it's a stem cell rich organ. So the story I tell, or the interesting anecdote about the liver I usually tell my patients is, for people who donate their livers to someone else for a transplant, 60% of their liver gets taken. It grows back in 6 weeks.
See? As I know now, sometimes I have an ultrasound and they go, "Oh, you have a scar on your liver." It's like, yeah, that's nothing to worry about. That's just where it was cut out. So, but it has grown back. So it's good. So March is Liver Health Month, and the Canadian Liver Foundation is urging all Canadians to find out if they are at risk of non-alcoholic fatty liver disease by visiting liver.ca/check your engine. And you can take an interactive quiz and receive practical tips to better your liver health every day. What would you say people should say to their doctors if they're concerned?
I think if people are concerned, they should have a conversation with their doctors about what are some simple changes they can make in their lifestyle to improve their liver health. Simple things that people can do is cutting out the snacking at night. That's a killer.
Why?
I
at
love
night?
snacking at night.
Snacks at night are usually hh calories, lots of sugar.
That's when I have my chocolate.
And you're going to sleep afterwards. So they all get converted
so you're
to
not
fat.
burning it off.
Yeah. The other thing I would recommend is coffee. Coffee's good for the liver. Good
Yay,
for prevention
Christine,
of
there you go.
cardiovascular disease.
How about wine?
I would say in moderation, a bit of wine is okay as part of an overall healthier dietary lifestyle.
The key word there is moderation.
I know.
Your idea of moderation and mine might be very different.
And maybe most importantly, make sure you have a primary care provider that you see regularly that keeps tabs on you for things like diabetes, high blood pressure, because all of these diseases go together with fatty liver.
So
Melanie,
if you had fatty liver, would you have high blood pressure?
You may, but if you have high blood pressure, you have a high chance of having fatty liver.
Okay, Melanie, what would you like everyone to know?
To get themselves checked, it's very important to do the physical and ask the doctor to check the liver. It never hurts. Fatty liver can be prevented also, so make better, healthy choices. That would be my advice.
Well, Dr. Hemant Shah and Melanie Braga, thank you very much for informing us all today.
Thank you.
you.
She said